We're just sitting there like, oh, gotcha. Well, we are so happy to have you here today. We've got a great crowd. And again, thank you to all of our participants for coming today. We are so happy to have Jacob Lauria and Katie Morgan from our N1 Health. And I'm seeing I might be on a little bit of a lag too. So Zoom is just not my friend today. But this is part of our career networks that we have our platform, but this is part of our Explore pillar. And so we are so excited to have this novel interaction. So this is one of our new Fireside Chats where we have kind of a newly minted young professional, and we have the leader, the executive of their company, albeit a CEO, a president, etc. So today we are just so glad to have two brave souls come and help us with this novel experiment that we have. The way we will run this is very similar to our usual Fireside Chats, where we're going to have our two guests introduce themselves, but then they have Katie has a few set questions, and then I have sent a couple of student questions, but then we will open it up to the crowd. So again, this is something new. We're excited about it. And I'm going to let both Katie and Jacob introduce themselves today. And Jacob, I don't know where you are, but it looks absolutely lovely. So I'm going to turn it over to both Katie and Jacob. So welcome.
Great. Katie, please go first, given the connections to the UNC program here.
Sure, happy to. So hello, everyone. I'm Katie Morgan. I'm a senior project manager here at N1 Health. And I am really excited to be joining this. As Suzanne was saying, I have been at UNC. I graduated there undergrad. I was a business major and a Spanish major. And then I also got my MHA, finished that in 2020. So was in the School of Public Health for that Master's of Healthcare Administration. And I also worked for UNC Health while I was doing that. So grew up in North Carolina, have 2 degrees from UNC and work for the UNC Health System. So I definitely am always cheering for the Heels and a big fan of UNC and always want to be involved as I can, and looking forward to talking with y'all today. Jacob?
Great, excellent. Thanks so much, Katie. I'm Jacob Luria. My background originally started in the population health space, serving as an early employee of a company called Arcadia IO, which is a population health management company. Then moving into management consulting with ECG Management Consultants, where largely I built health plans. Which was a tremendously fun role that I'm sure we'll talk about. And then about 5 years ago, founded and was the CEO at Algorex Health, now N1 Health, for about 3 years. And then asked one of our board directors to join us on the leadership team and now serve as president for N1 Health. I'm very excited to be here today and give a little bit of perspective of how we view the world.
Great. And should I get started with the questions right now, Suzanne?
Yeah, go and ask. I'm so interested to hear what you want to know.
Awesome. Well, I'm looking forward to this, and yeah, we'll definitely take some questions from the group as well, but I'll get started with Jacob. I'd love to hear, your experience with building a company from the ground up.
Absolutely. So very small question there, right? There's many components that kind of tuck in to sort of actually bringing that component forward. And one of the things that I think I was able to learn from a few specific mentors that I had early on that helped me in building a company was really to separate the components of what is a really good idea, right? And what is actually a company, right? And there's a significant difference in terms of what's a great idea, what is something that we should be doing, right? And in the US healthcare system, there's probably a million different good ideas, right, that are out there that we'd all look at and say, these are things that we should do. But then how do you actually turn that into a company? And one of the sort of areas of focus that we've had throughout that process is, for the lack of better sort of areas to focus on, is in the commercialization, right? And when you think about the key difference between what's an idea and what's a company and how do you build a company, right? Taking something that is sort of common sense or good idea and turning that into a commercial proposition, right? That has positive economics, both for the customers you work with and your teams. And to me, that's sort of the biggest difference between taking really good ideas and then bringing that into a company. Now, as we go through that process, and probably the biggest learnings that we've had and some of the biggest challenges is focus, right? Once you start playing with good ideas and you have 4 to 10 people around a conference table trying to figure that out, it's very easy to want to go chase every single good idea. And I think the experience that we've learned and the experience that I would pass forward is focus on singular good ideas that have great commercialization is really the way to turn good ideas into companies and really obtain the growth that creates greater opportunity for you, greater opportunity for your team members, and ultimately greater opportunity for those ideas, right, to actually flourish and turn into things real, right? And I'm happy to go into more details around what that looks like at N1, but the change of having good ideas and turning those into a company, I think really focuses on the ability for people to be willing to part with their hard-earned money to work with you on things, right? And be able to do that in a repeatable fashion.
Yeah, I think that also brings to mind a question around, how do you stay relevant in an industry that is always changing, like healthcare, and how do you kind of see where it's headed, and especially when you're trying to build a company and keep it sustainable?
Yeah, it's a great question. And when we think about sort of how to keep certain things fresh and how to make sure that you're providing something new to the marketplace, a lot of it just requires brute force market research and getting out there and speaking to as many people as you possibly can. When we started N1 Health, I didn't realize this, but there was probably 4 other companies in the US that were doing something extraordinarily similar, right? And originally, sort of my thought on that was, hey, wait a second, we're the first ones, we're the best, we should be the only ones doing this. And what I realized very quickly is that if you select the market you want to be in appropriately, there is plenty of space for other firms. And if you don't actually have other firms in that space, your idea is probably not that good, or it's too progressive for the time period, right? And you kind of miss that window. Right, there's so many entrepreneurs in the US right now, and there's so many challenges, especially in the US healthcare system, right, that more people trying to solve the same problem in similar ways serves much more as validation than competition, right? And so looking at those activities and trying to right time the market on ideas helps to try to find some of the components around what's a great idea. The best way to stay ahead of things is to build out a network of trusted folks that you can bat ideas off of, right? And have prospective conversations along the lines of, hey, if we could solve this for you, would that be helpful, right? Have you thought about looking at this? If we were to develop this, would your organization adopt it, right? And early on, we had a network of about 6 to 7 health plan executives that we had professional relationships with that really helped serve as that sounding board for us to understand sort of what's a realistic idea, right? And would it actually be used if we brought something like that to market?
And now thinking a bit about those organizations that we're working with, which largely are in the health plan space. I am getting a little feedback from someone that might not be muted, just FYI. But thinking about, health plans and the healthcare industry in total, it's a slow moving, pretty bureaucratic space. And so how do we get people to move? How, as a startup, that likes to move fast and make things happen, how do we get these large organizations to make decisions and to move forward?
It's a great question, and if anyone sort of on the call has great answers, I'd love to hear them, because this is something that we try to do and we're getting better at it. But the answer really comes down to, for us, is having what we talk about as buyer empathy. Right? When we think about all of the health plan executives, and this is true in any industry, right? When you're talking about individuals that are overseeing departments of 100, 200, 500, $1 billion of spend, right? Their time is incredibly limited, right? The ability for that large organization to do anything right? Even if it seems like spending $50,000 is a small thing, right? There's processes that have to be gone through. And early on, we realized that just providing a good idea to someone and a price was not enough to actually get that individual to move. And so when we think about the customer acquisition process, right, there's a chain of events that we see people asking, right? The first is this a problem that you're talking about that is relevant to me, right? So does this fall in my domain, right? Or is it somebody else's domain? And do I care about it, frankly, right? Second, is it a big enough problem that I actually have to do something about? Right? Do I believe these individuals sitting across the table from me and what they're telling me, right? And do I trust the numbers enough that, hey, wait a second, I actually do need to do something in this space, or am I okay with the status quo? And then the last question they're asking is this the right partner? Is this the right company to work with on those activities, right? And so once you get to that point, right, it's worthwhile to make sure that you lay out the entire program of what's all involved before you're asking for a yes or a no or specific dollars. And it's worthwhile to make sure that we respect that our buyers, right, for them to work with any company in the health tech space, have to share data. That requires a giant information security program. That requires trusting us with significant risk of potentially a breach of personal health information. And so all of those downside risks have to be mitigated before they're willing to move forward. So it means that this is an asynchronous problem, right? Where you need to do more, right? To be on an equal playing field with the person you're talking to say, yes, we should move forward with something. And so doing more, right? And over presenting and understanding what a full solution is, a full closed use case, even if you're just doing this tiny part of it, is necessary for someone to actually say yes or no, right? So it's putting yourself in their shoes, having strong buyer empathy, right? Running through the key questions of, is this relevant to me? Is it a big enough problem I have to do something? And then with whom am I going to try to solve that problem with?
And given that a lot of people on the call are, furthering their education and learning, more about a certain field of study and different skill sets, I'd be curious to know, what competencies, what skill sets do you use daily in your role here? And what do you think is helpful in building a startup in the healthcare industry?
It's a great question. And for startups generally, it's time management, right? At the end of the day, the most limiting resource you have if you either start a company or take a leadership role on a really early startup is time, right? And it's typically your personal time, right? Every other resource in terms of hiring folks, getting more money, or solvable problems, right? But you're never going to be able to work more hours in a week than what your personal cap is. And so time management, prioritization, and delegation sound like things that aren't necessarily sort of being furthered in field of study, but have been the things that, as I've gotten better at personally, and as I've seen sort of our teams get better at, has led to our company's growth, right? So I think that as you enter into sort of early stage companies, startup space, founding companies, really think about, is that environment where you will never be able to complete everything on your to-do list something you want to do? Right? Some people thrive in that model, right? Some people don't, and that's completely okay, right? But being able to build out sort of time management and systems to help manage everything that's going on has been sort of the critical one that really surprised me, right? I thought that, I've been a successful professional. I can sort of accomplish my sort of day-to-day work activity. I can get everything done. And then very quickly, it becomes much harder than you ever imagined. And the amount of things that need to get done, that list just cannot be accomplished.
Terrific. And I'm going to kind of wedge in here because I do know that we have a robust audience, and I'd love to see if we've got any questions from our participants today. Again, you can raise your digital hand. You can just unmute and ask the question, but I'd love to hear what you all would like to ask, because so far this information has just been invaluable, but I'm sure that you guys want to dig a little deeper. I'm looking for the hands. It's Friday. Let it go, guys. ask those important questions. I see Christine Pham. She's the president of our healthcare club. Ask away.
Hey, Jacob. Hey, Katie. Thanks for having us today. Really appreciate it. So one of the things I'm always interested in is asking professionals, what is something you would have done differently in our shoes when you were 28 to 32 years old? What were the barriers and challenges that you had that are like, wow, if I had that insight, I would have made a different decision, if any? And then I have another question too, just based on N1, but I'll stifle my questions because I have a lot. This is great.
No, it's a good question. Katie, do you want to start?
Sure, happy to. I am very solely in the middle of that age bracket, so I will share from what I'm doing now, I guess, and thinking towards like what I think I've learned. I actually got into healthcare a bit by accident. I said I studied business undergrad. I was really focused on entrepreneurship, nonprofit side of things, focused on food insecurity particularly, but I worked with a startup my senior year and the summer after that was in the food space originally and actually pivoted to be a primary care pipeline startup. And that really opened my eyes to the impact that, healthcare can have and how that can be a really mission-driven job. And that really spoke to me. That's really where I found myself being compelled by the work that I was doing. So I would say, like, for me personally, something that I think I was focused on, what does this look like in terms of prestige a bit when I was in school? And I found that wasn't fulfilling to me. What was fulfilling to me is like, what wakes me up? What do I feel like is doing something that is compelling to me, that is a mission I can stand behind and feel proud of working for? And I think that's really led me here to N1 Health as a nice combination of what I was doing before at UNC Health in the strategic planning space on the provider side, knowing that side of the healthcare industry, but getting a little bit closer to what does the social side of healthcare look like and how can we understand both sides to really help make a difference in people's lives.
Yeah, I think I'd follow similarly. And I think there's a shift and there's a lot of puts and takes on the 10,000 hours theory, right? That when you spend 10,000 hours doing something, you're now an expert. I think that that is probably more accurate than I ever thought it was in terms of activity. So when I hit about 5 years after doing consulting, I was like, wow, I actually have confidence that I know what I'm talking about here. And to be blunt in that space, I probably stayed too long in the learning activity and questioned a lot of the confidence that I had around, oh, wait a second, the executives that I'm sitting on the other side of the table from, right? I have as much experience in these specific domains as they do, right? And I should treat myself as a peer these individuals regardless of age, right? But from understanding of, I do know this domain, right? And sort of that shift from learning to doing. And so I stayed personally a little too long in the learning space, right? And had myself doing consulting projects that, if anyone knows things about healthcare reimbursement, was too focused on purely dollar reimbursement changes, on shifting practices to hospital outpatient activities to get an extra sort of return on what those reimbursement rates were, versus doing something that had a sort of set of nobility and things that I felt was really important, right? So I was probably a couple years late in hindsight to laying the groundwork for N1 Health, where in our work, right, we try to focus on getting the sort of most underserved individuals in the healthcare system the resources they need, right? Something that's super important to all of us here, and wish I'd done it 2 to 3 years earlier, sort of coming out of that 10,000 hours component.
Thank you. That's great. Would I be able to ask one more question? Okay. So for me, I also have a healthcare background. I was a provider for 6 years. And so obviously this is really important to me because I worked in rural and urban areas. Social determinants of health really plays a key role in healthcare. We're noticing this like trend in the past like 10 or 15 years. how are your algorithms platforms integrating geographically, like data, zip code, and like identifying these zip code diseases in order to use them for predictive analytics for your clients to really improve outcomes and access? And this is something really important because in North Carolina, we're number 2 in the number of rural patients. And so, how are you using this data for power?
Totally, it's a great question. So to take a step back, right? So one of the primary reasons that we started the company is we realized, especially Medicaid and ACA Affordable Care Act plans were financially accountable for big populations, but knew very little about those big populations. I think that the statistics are about 40 to 50% of Medicaid and ACA patients will have an outpatient visit every year, right? And so the health plan or financial ACO is blind to those patients, for lack of a better term, right? And so we use social data, right, that we actually use beyond geographic data, sort of at the individual and household level, for us to try to understand what are the social acuities of those individuals, and then turn those into programs so that we can try to resolve some of those challenges as they relate to people seeking care. Let me give you a very, very specific example, right? If someone lives 30 miles away from their primary care provider, right, and does not have a car, right, their ability to make that appointment, right, is probably 65%. If no one within that household has an active driver's license, if there's no vehicle registered to anyone who lives at that residence, their ability to make that appointment is 50%, right? And so if we know that, right, at the time of scheduling the appointment versus waiting until that patient might have a risk of no showing, we can try to intervene and proactively offer services, right? Much of the legacy model of understanding social needs of individuals is to ask them, right? Is to say, Christine, do you have a car? Do you have any transportation issues, right? And we believe that direct one-to-one asking is retroactive, right? So you require someone to walk into the front door or the digital side door of a health system before they can report their deep needs, right? And that question comes off in a very challenging proposition, right? Christine, you don't know me, right? And if you were a patient and I was a medical assistant, this would be the same relationship, right? You don't know me, and I'm asking you very, very personal questions, right? And at the same time, the biggest challenge that I would have if you actually said, I do have a challenge, is I don't have any resources for you, right? And so we use all of our investments in data from consumer marketing companies, right? The companies that ship us catalogs, they're a little too targeted, right? But they know a little too much about us. And we use all of those strategies to get ahead of asking people what their exact needs are, right? And then because we've done so many outreaches and offers, we use that as training data so that we can take consumer data and training data and run a machine learning pipeline to actually put those two things together to launch programs that actually help people. So happy to go deeper on that. And if you have a follow-up, I'd love to get there. But our perspective is that waiting for individuals to self-report their needs means that you're always behind the 8 ball, right? And you're always retroactive in trying to help someone.
Oh, I 100% agree, because a lot of these comorbidities too, patients are most often like asymptomatic, like diabetes and hypertension, until it's way too late. But yeah, thank you. This is great. I really appreciate it.
Of course.
Terrific. Opening still open for another question or two. I'm sorry, I'm just scanning our group. And I don't mean to intercede, but I do have a follow-up question kind of tagged on to Christine's is, do you all partner with any local groups that are trusted entities that are already providing, say, food and food support or elderly, that centers where folks, that are Medicare, Medicaid might go for that trusted referral process?
Absolutely. We would not call it a referral process, and I'll tell you why, right? Because there's a very important reason for that. But yes, our teams and our staff are not the people who are calling patients, right? And largely because we're not trusted in those neighborhoods, right? We don't have the sort of understanding of sort of how to deliver social needs and how to do that in the appropriate manner. Many health systems and health plans have relationships with community-based organizations that provide social support on a grant-funded basis, right? And one of our customers worked with a local area sort of nutrition support and sort of food insecurity group, right? And they gave them a $300,000 check every year, right, in January, and that funded broad-based operations. What we did is once we identified that out of their 240,000 Medicaid members, right, there was about 3,000 individuals who were completely unengaged with the health plan and lived in one of their core service areas and had nutrition insecurity challenges from our modeling, right? We actually went to that local agency and said, if we were to pay you, right, to launch a program to proactively offer services and build a program for these 3,000 people, would that be something that you'd be interested in? And they said, absolutely, we'd love to move our activity upstream. We think we can get a better bang for the buck. We can make our $300,000 feel like $1 million if we're proactive and making sure that the individuals with the highest needs get those services. And so this is how we started with an analytical exercise, right? And what it changed in the entire program for this health plan is now that group that had a prior grant funded relationship is reimbursed on a case rate for services, right? So they provide a program proactively, and that organization earned about $560,000 last year in reimbursement for services from the health plan, right? The health plan had about a $940,000 medical expense reduction. So this was a financially sustainable program for the health plan. It increased the funding for the community-based organization, and they're trying to grow the scale of that activity, right? To us, that's a giant win, right? And that moves away from the legacy model of we should just let those organizations have full freedom, which we largely think they should do in some areas, but reimbursement for services and tying that to the financial benefactor, which in many cases is the health plan, can increase the funding for those trusted organizations to do more and to be more specific in proactive outreach.
Awesome. Terrific answer. Thank you. And Abe, we've got another question.
Hi, Katie. Hi, Jacob. I'm Abe. I'm actually an MHA MBA dual degree. So Katie, I'll have to say hey to Jeffrey for you. But just a quick question, more about AI in healthcare. And as someone who is way past the point of ever becoming a data scientist or getting into building analytical platforms and being more on the business side of healthcare, what advice do you have for someone who's interested in AI in healthcare? I have about 2 years left to kind of really invest my learning into it. What skills should I try to get out of it if I wanted to enter that field? And what skills should I develop? And then what would a typical role look like for me as well? Because, you know, at the beginning of our stats class this year, our professor had a good spiel about how data scientists need business-minded individuals to help guide their companies. And that's the kind of roles that we should be looking at. So what does that role look like for me down the road, as well as what skills can I develop to be the best leader possible in the field?
Yep, great questions. The core component right now that I think is underinvested in people entering the workforce is core statistics, right? Is being able to not necessarily write an algorithm or a model, right, but understand precision and recall, right, and understand sort of what does that actually mean, right? As the world becomes more driven by models and algorithms, to say it very frankly, being able to call bullshit very quickly is going to be a very, very valuable skill, and that needs to come from core statistics. There are many companies and many people who are pushing things just a little too fast, right, on those activities, and so being able to sort of be super fluent, especially in precision and recall on those activities, is very, very important. Roles, right? So the interpretation of a model and the understanding of how a model is applied and should be modified is starting to become more and more important. And let me give you an example of that, right? Models can be very accurate, right, at very high levels and have no population, right, and no audience that leads to that, right? So if I want to be accurate 100% of the time, I might identify one individual that doesn't have a transportation option near them, right? That's good from a modeling perspective, but helping one individual is not the power of AI, right? And so being able to understand what are the rational and acceptable error rates are business decisions, right? So what level of accuracy, what level of precision do I need to make a $25 investment in a member? What level do I need for a $100 level of investment? What about a $10,000 level of investment, right? And those level investments could be a box of 6 frozen meals, right? $100 in an Uber Health coupon credit, or rent for the year, right? And those are business decisions in terms of, what do I need to believe? What level of accuracy am I comfortable with from an analytical and AI and model output perspective for me to be comfortable making investments at those levels, right? And more, that's becoming the interpretation and sort of the client side or customer side activity of, how do I deploy a production model in your environment to do certain things and make key business decisions. So I hope that's helpful. Happy to take a follow-up, but I'd say interpretation of algorithm to business decision, right? And what's that sliding scale specifically on precision and recall?
Yeah, and Abe, nice to meet you too. I was just gonna come in here as a fellow non-technical person that is fully in this realm now. And I think one thing that I'm always working to get better at, but I think when it works well, it's really exciting, is like, we here at M1 Health have a really talented team of data scientists and engineers, and we can wow people with the data that we have and the models that we can run. But often what we need to do in those conversations is, sure, we can wow them, we can tell them all that we can do, and then we need to really like stick the landing, right? Make sure that they can understand why that matters to them. And I think if you're thinking from a non-technical lens, what you can focus on, it's like Jacob was saying, the interpretation, and really making sure that, you know, you can come with that very clear value that is coming from, why should we do this, you know, because if they're kind of looking at all this data, and we definitely get into this, it's something that is hard to do. So it's a good skill to work on, but looking at a bunch of charts, like, where do I need to look? What is important? What is this telling me? And, you know, sometimes that's breaking down these sophisticated models to the most like elemental facts of them, so that you can say what's important and why we want to do something about that.
Thank you both.
Awesome. And let's see, Christine.
I have one more question. My summer internship revolved around a ton of data and different data sets from third parties. And I never thought I was going to have to do this. So F411 for all those the first years, you're going to have to learn data and get used to it. I went into a marketing role and I was like, oh, I wanted to deal with numbers, whatever. That was a lie. So for me, this summer, there was so much data. I felt like there was a lot of data overload for me. And there weren't a lot of protocols in place to really assess the quality of the data. So how are you choosing meaningful data sets with your training sets to create something that's value added?
Yep. We control the process, right? So healthcare data is ugly. That'll be the first one to say that. And a lot of the most important data comes from non-traditional sources. And what I mean by that is every state Medicaid agency has a Medicaid transportation broker, right, that provides transportation and ad hoc rides for Medicaid individuals. Very few Medicaid health plans get that data and understand ride patterns, right, and say, I took this member from point A to point B, right? When you look at that data, you can realize, oh, point B is a grocery store a lot of the time, right? That individual might be someone who is helped by delivery services for grocery, and then turning that into intelligence. For us on the data standpoint, we actually do as much as we can, and there's some modern tools to take whatever data exists and then use categorization at the end point. Right. So what I mean by that is our training data all has the same dispositions. Member was offered X, did they accept it, decline it? And that sort of core piece becomes what we need in a standard format for us to have good, clean training data. If we do not have a good training data use case, we don't worry about it, right? Because we know the challenges of getting everything right is too painful, right? It'll take thousands and thousands of hours for us to clean every data field, and it's not worth it. So we try to focus on the really, really important fields and spend a lot of time on those specific fields.
Great, thank you.
And did you learn that experientially, or was that some great advice that was handed down or something in the field?
No, it's a great question, Dan. We learned it because the first program we did, we couldn't measure the efficacy. And that was a really unfun conversation for us to say, awesome, we did this great program, we feel really good about it. And then we were asked, okay, what happened? And we realized that there was about 3 different organizations that had the data we needed to prove what actually happened. And so we learned that lesson once and hope to never learn it again.
Awesome. That's fantastic for people to know that sometimes your mistakes kind of are value add themselves. So
And the only thing I'll add there, Suzanne, is we make mistakes every day, right? And we are not necessarily focused on our overall trend. We are much more focused on our level, right? Sorry, we're not more focused on our total absolute level of performance. We're much more focused on the trend. Are we getting better day in and day out, right? It is so much more important for startups to figure out how to get better than worry about absolute performance.
it's fantastic advice. And Brett's got a question.
Yeah, thank you everyone for being here, and thank you CBOH for setting this up. Very similar to Abe, I'm interested in entrepreneurship in the digital health space. My background is software product management, so I have a little bit of technical expertise, but in terms of AI and machine learning, pretty fundamental, low level. So similar to Abe, just kind of wondering how you would prioritize time in terms of like what level of depth is valuable to know, and then also specific resources to build off of Abe's question. How do you tell stories with that data? How do you convey the impact to your client? Those types of things. So yeah, any resources on that would be really helpful.
Great. Yeah. I'd continue to emphasize sort of understanding of statistics just is core when you start thinking about AI ML, right? At the end of the day, it is statistics on steroids, right? That just sort of compounds on itself. Resources. This is going to sound like a non-traditional one, but looking at data-driven journalism, right, and treating that as an exercise. One of the companies that does a really, really good job with this is 538. It's Nate Silver's sort of election forecast website. And the most important thing that they do is every single one of their articles has a GitHub repository, right? And within that GitHub repository is both their data, their Python scripts, and their processing. And so being able to recreate one of their articles or one of their analysis from the raw GitHub data repository is a great exercise in how do I take raw data, how do I run an analysis, right? Some are simple, some are complex, right? Some of the crazy election ones I'd stay away from, right? But they do some interesting things like what's the best burger in every state, right? Showed up a couple of years ago, right? So some sort of mundane ones. But to me, that's a great sort of open source resource that you can look at and be like, oh, what are they doing here, right? And then how are they turning that data into a story, right? So that it can be well understood. Second component, Coursera just has great resources in terms of getting through sort of self-learning. I'm sure the school has ones that are probably more involved that I'd encourage you to invest in, but Coursera and 538 are kind of the two that we're constantly pushing down to our teams.
Great. Those sound very helpful. Thank you, Jacob.
Terrific. And I'm going to turn it back over to Katie. I believe we had maybe one more student question, or we had some other questions that you had. So I'm going to turn it back to Katie for a little bit, and I want our audience to keep churning and thinking of those questions for our next gap.
Great. Yep. I did have another question kind of around pivoting into this industry. I know that that's something that I did that I talked a little bit about, but Jacob, any advice or things you could suggest for people to focus on if they're trying to move into healthcare and might not have that background?
Yeah, really good question. I think that healthcare is held up as somewhat of a special industry for a number of reasons, right? We all seek care in terms of how we interact with the healthcare system. But the best guidance I can give is healthcare is a business, right, at its core. And it has financial inflows, financial outflows, right? Revenue, expense, just like anything else. And so understanding the complicated nature of what's a premium dollar, what's a medical expense dollar, what's an administrative cost dollar, and starting with how is healthcare a business first helps understand just why all the players act the way they do. there are a number of online communities that help in this activity, especially in the digital health space. Health Tech Nerds has been a great resource for me personally, but is also one where people share a lot of information. There's a few others. HIS Talk is a great resource, just sort of with a good pulse on sort of the business of the health tech area. But I think it's first start understanding sort of healthcare 101 as a business, and then starting to go the level deeper based on your interests. If you are looking to get into healthcare, I strongly encourage you to start with one domain and go deep. Right? If you really want to get into this space, become an expert in some area, right? Experts are listened to in these components. Experts are credible when they launch companies, right? Experts are credible when they launch new solutions on these activities. And so being able to pick one goes a really, really long way.
Yep. Any other questions from the group? I have a couple others, but I want to make sure we take some questions. All right, go ahead, Brett.
Yeah, just a really quick qualifier on that answer, Jacob. When you say becoming an expert in a specific field, I'm someone who doesn't have any healthcare background, obviously, but I'm looking to pivot into that field. Would you say specific verticals or even more domain specific?
Yeah. I'd go a little bit
vertical?
more specific. So healthcare, when you think about it sort of in the professional world, it typically includes like life sciences, right? Inpatient, outpatient care and pharmacy, and then sort of the suppliers of the industry. So I'd start with one of those four verticals because pharma and biotech look totally different than anything I know, right? Early on in my career, I ended up understanding outpatient care and population health, right? So that's sort of how does healthcare reform matter, and ended up sort of becoming more of a healthcare reform expert in that health. But I think focusing on care delivery, care financing, pharma, biotech, or the health tech industry, I'd pick one of those five at a macro level, just because the economics and sort of operations are so different between those five verticals. There's very little crossover.
Great, thank you very much.
Another question that we had was about a piece of advice that has stuck with you throughout the years and you think has contributed to maybe your success, or at least something you might reflect on. I know I have something myself, but I'll let you go first.
Sure. So this is actually an interview question I got at one of the big four consultancies, but the interview question was, would you rather be right or be followed? And to me, it's a fascinating question. And I think it gets back to the idea of sort of what's an idea or a company, right? Individuals can be right and have great ideas, right? Individuals that are followed have companies. And I think that you can only go so far as an individual. And so being able to understand that a team, even with a suboptimal sort of idea, goes much, much, much farther. And so especially sort of in the early stage startup, running a department, launching a company space, would really focus on sort of that ability to bring a coalition of individuals along for that ride, and it will have a much, much bigger impact.
Love that. I haven't heard that before. It's got me thinking. For me, a piece of advice that I got actually in my last job from someone that I admired as a woman in the space and leadership in the C-suite, with a family too, who also, was just asking her about kind of career advice in general, thinking forward. At this point, she knew I was moving and leaving too. So just talking about what she might want to share if she was in my shoes. And she was saying that, it's not unique to her, but just that, you can have it all, just not at the same time. And so I think for me, it was a good reminder of the balance that you need to have in life, that you can try all these different things and it's okay to try them and decide you don't want to do that and you can do something else, which is definitely something I've already done in my career of pivoting into healthcare when I thought I was kind of headed more directly into just the food space. But it's something that stood with me.
Awesome. Those were two really great and very different pieces of advice. Again, too, we always encourage students again, as we're sitting here, to ask these questions, because sometimes you get that nugget that really does stick with you. So again, I'm encouraging students. Very rarely do you get this chance, to ask, both somebody who kind of was in your shoes a couple of years ago, or somebody that is an executive with a company. Again, too, just think about it. No question is silly, but we'd love to hear you, at this point in time. All you Suzanne Killians out there. Oh, here we go, Abe.
Yeah, I'll ask another one if that's okay. Recently in our marketing class, we had a lecture on branding, and specifically the pros and cons of rebranding an organization. And I know that 3 weeks ago, you guys went through a rebranding process for going from Algorex to N1. And if it's not too personal, I'd just love to hear how that's going, what the thought process behind that was,
Sure.
What your plans are for the future now that you're N1 instead of Algorex.
Yep, happy to, right? So this is an incredibly personal answer, but once you see Algorex as Al Gore with an X after it, you cannot unsee that. And we've been asked before, was that sort of any part of our activity? And also at the end of the day, sort of Algorex Health didn't have a singular tie to what we were doing as a company, right? It was more cool. We had algorithms sort of, and we worked in health, right? And when we first started the company, when we had a really broad set of ideas, that was more appropriate. But as sort of our core sort of product offering is a detailed understanding of each and every one of the members or patients that you're seeing, right? We wanted to find a name that more closely tied to what we actually do. And as we include more individuals in our sales, go-to-market, marketing, recruitment activities, right? Having a name that correlated more with what we do was necessary to make a strong impression, right? And also sort of help tell the story of why N1, right? It's much easier for me to say, like, we started N1 because we believe knowing as much as you can about each single one of your members matters, right? That has a clear tie in terms of what we do to the name. And we had lost that in Algorex.
Thank you.
So far, it's going well. Our customers like it, right? I think they agree with us that it's helpful. Plans for the future, not do it again, right? Because it's a lot of work.
Awesome. And as you were planning the rebrand, et cetera, what did that look like? Did you have, did you send surveys out, to the folks in your company? Did you have just like an executive committee? Did you actually connect with like a branding company? What did that look like?
Yep. So we actually, the name N1 was actually determined by our current management team, right? It was an option that someone else put out there, and it was sort of always on the table. We did engage a marketing firm, a general agent marketing firm to help us with that process. They came back to us with 30 other options of names, and all of them we didn't think were better than N1. And so we ended up selecting that and then working with them to create sort of the design aesthetic, the logo, the color scheme, all of those components, so we could make a clear switch over of website and all the associated collateral with that.
Terrific. Caitlin.
Hi, yes, kind of, this is a pretty broad question, but I'd love to hear what you're most excited about going forward into the future, whether it's in the healthcare space or for N1.
Yeah, Katie?
Sure. Yeah, I think on the rebrand, I think we have had a lot of good feedback from our clients. It's also, I think, a clearer story. So thinking about what I'm excited about is like how this helps us pivot to do more with the clients that we have. I think we definitely have done a lot in the SDOH space. That's like always going to be part of what we do, but we also have the power of all this data that we've been talking about. And so we can add that social risk layer into a lot of the analyses that we're doing. We can look at outreach that these organizations are doing with that layer, and it doesn't have to be maybe as focused on a direct intervention, but understanding how that incorporates into everything that they're doing. So for me, what gets me exciting is the sustainability of that, right? Because something that is a direct intervention is sometimes a point in time, right? You're helping someone. I love that idea, but does that really help solve the issue of inequity in healthcare for a time? Yes. But what really could make a bigger difference is taking a step back, looking at, okay, is our outreach biased here, or we're only reaching the people that are already engaged? How do we reach these people that aren't engaged with the system? What's the best way to get in touch with them so that their health doesn't continue to worsen? That gets me really fired up and really excited about where we're headed.
I think I'd piggyback on what Katie said. The thing that's most exciting for me is how do you deliver care, inclusive of medical and social care, to the individuals that need it, not just the people who are really good at raising their hand, which is how we do it today.
That's terrific. And I guess that's very translatable. Oh, terrific. So group, we've got about 7 minutes left. So this would be a good time to raise your hands and ask some questions. So I'm again perusing. Raise those digital hands. There's got to be something interesting to ask. Again, from the startup realm, from digital health. Again, we here explore the verticals, and this is a very rich, dynamic vertical that again is new. I mean, if you've been in healthcare a long time, there was a time when this wasn't the technology that you had. Let's see, anything? Alrighty, well,
And
we've got 2, terrific, and Alan, and then Caitlin, and then Brett. So let's go to Alan.
Sure. Thank you both for your time. I hope you can hear me. I'm just curious from a startup's perspective, exiting a pandemic and entering a possible recession. How are you bracing for that? And how do you see your existing or future clients kind of changing the way they interact with you?
yeah, so I would say our clients, we've not seen tremendous changes on. But the funding environment has changed drastically. Valuations are down 40 to 50%, in some cases 70 to 80% from where they were even 18 months ago. We have taken a more measured approach to fundraising, partly because we have a belief that the management team versus institutional investors are better stewards of the business. And so when we raised our Series A, we raised about 10% of what we could have, with the goal to maintain as much control as we possibly could and not have to grow into next level valuations, right? And so an easy way to think about institutional investors is when you complete a round, your post-money valuation, they're looking for you to be at least 3 to 4x that before another funding event, right? Or transaction event. Right. And so that means you have to do a lot of work, right, to make investors a lot of money. We wanted to make sure that if we were in a situation that all of the employees and management team would be happy with an outcome, we had the flexibility to do that, which means that we've not raised the mega rounds that other companies have. And that's made it this sort of downturn in the economic area easier for us to handle because we're much closer to profitability than others. Companies that are entirely dependent on raising rounds every 18 months are significantly negatively impacted. And that's the companies that you're seeing have significant staff reductions right now. But focusing on core measures, focusing on profitability in terms of that sort of not having an idea, but actually having a commercial business from the start has put us in a better spot there.
Thank you. Very helpful.
Caitlin.
Thank you. So kind of thinking back to the interventions between and the relationships between payers and community-based organizations, how do you envision scaling that going forward, or what does the future of that look like?
Yep. So I think that there's 2 different use cases that are worthwhile to think about. right? One is that I have a patient or member on the phone in person and I need to refer them to appropriate services, right? And there's companies that have built networks of community-based organizations so that I have high scale, right? That I can put that tool sort of at the point of care in a lot of different places so I can do a lot of one-to-one referrals, right? We think that's great, right? That the world that we live in is a little bit different, and how we scale is we try to run our models and understand the social acuities of very large populations and then work with organizations that can deliver high volume interventions, right? So there are organizations like Mom's Meals that can deliver 100,000 meals, right? And work with some of the groups that have true infrastructure, but there's a scaling challenge, right? So at the one-to-one level, you need a huge amount of supply, right? When you have a huge amount of demand, you need less fulfillment partners to try to create that high scale. And you need organizations that have a lot of infrastructure. So it's matching the right organization to the right problem so you can actually fulfill at scale.
Terrific. And so we are ending our time. It seems like we have 2 minutes, but by the time I finish just even saying this, we're really going to get tight. So first of all, I just wanted to ask both of you if you had one just parting sentence or two of advice for our myriad of students here today, and then we'll wrap up the session.
Sure, Katie.
Great, I get to go first. I think maybe kind of you've seen this be a theme across what I've said, but I think, you know, trying new things is what I would say, like, especially when you're in school, it's a great time to just trial something and see if you like doing it, if that's gonna like be something that you will want to do and you can see yourself doing for the rest of your career, or maybe then you try something else new. So that's what I'd say.
Great. I would say be willing to fail, right? Most people are surprised that I probably give 20 pitches a week and maybe 2 go forward, right? So a 10% success rate is massively high. And so the amount of times you have to get comfortable being told no over and over again in the startup space is challenging. And so get used to that, get better at it, but be comfortable being wrong, be comfortable being out there, right? And most importantly, just get better.
Two wonderful perspectives and great advice. So I just want to thank you all today, Jacob and Katie. First of all, it was absolutely appropriate that a startup would take the risk to do this innovative, new program that we have. I think it worked splendidly. We so appreciate the audience and the wonderful questions that our students have. Again, too, please, I'm going to go ahead and put our website for our career networks, because you can catch Jacob again November 8th for our digital health technology and health innovations panel. So again, I can't thank you all enough. We welcome you back anytime, and please, students, take a look at N1 Health. That might be a place where you could start your career someday. So again,
and Suzanne, I would go even farther than that and say, please consider us. We are growing. We'd love to hire from the North Carolina area. I think 30% of our team has ties into the North Carolina area, which is great. We'd love to see that grow. And recruiting is one of the biggest challenges. So if you are interested, be in touch. If you have friends or people in your network who are interested, please be in touch. If you're going to work, you might as well work with friends. So lay the groundwork, work with the folks that you know, and please pass them to us, right? We're trying to grow, and it's always a huge challenge to get the right folks on board. So thank you so much for the time.
Great. Thanks, guys. Everybody have a wonderful day and a great weekend. I know you just finished your midterms, so so have fun. Thank you.
Thanks, y'all.